Hi, my name is Jonathan Cuevas, and today with Alexandra Crespo we're going to be talking about Timethoprim. Timethoprim is a biostatic antibiotic, which means it's not an antibiotic that will directly kill the organism, but instead it will prevent it from producing DNA, and thus the organism won't be able to replicate. It's prescribed together with sulfonamides. Both antibiotics work together synergistically to produce a bigger effect and thus inhibit even better the way the DNA reproduction in the organism, so the organism won't be able to replicate. Timethoprim is used to treat several types of infections. The most commonly used is for ear infections, urinary tract infections, and traveler's diarrhea. It's also used to treat several other types of infections, always bacterial infections. It will never be used to treat any type of viruses.
The action and mechanism. Timethoprim inhibits the dihydrofolate reductase, which is responsible for reducing the hydrofolic acid to tetrahydrofolic acid. This is the essential precursor in the synthesis of replication of the cell. Some bacteria cannot consume folic acid, which means that they depend on their metabolism to produce it. Timethoprim inhibits the production of metabolites, which are required in the synthesis of DNA. Therefore, Timethoprim inhibits the replication of the cell, so it dies. There are common side effects like any other drug in the market, which are diarrhea, upset stomach, changes in taste, nausea, and vomiting. There are also more serious ones like swollen tongue, dark urine, irregular heartbeat, swelling, signs of infection, and easy bruising. There should be many precautions taken when taking this particular drug, because it inhibits the folate synthesis, which means that any people with any certain type of anemia should not take this drug, and also people with kidney problems, because the kidneys are responsible for the excretion of chemical substances, and if not excreted properly, it could create chemical imbalances in the body.
One of the biggest problems scientists have had using Timethoprim is the resistance of organisms towards the antibiotic. During the 1970s, there was a study conducted in Finland. During 13 years, they tracked how much Timethoprim was prescribed in the hospital and how much the resistance towards the antibiotic changed. What they found is that between 1970 and 1980, there was approximately an increase of 10% in organisms that were resistant to the antibiotic. In that same span of years, the amount of Timethoprim that was prescribed increased from 7 to almost 14 kilograms per year. One of the problems that we've had throughout the years is Timethoprim, because it's so effective, it's been overprescribed. It's also been in the market for so many years. It's been used since 1970, so it's almost 40 years. So there are going to be organisms that are going to mutate, and they're going to have resistance to antibiotic, because they're going to have enzymes that are going to be resistant to the antibiotic.
The accessibility. One of the things that we thought, or we experienced through this research, is that the antibiotic Timethoprim is not an expensive drug, so it got us to thinking that that it has so many it treats so many bacteria, and also is not an expensive drug, so that's why physicians they prescribe it so much, and we think it's very good. Also, it has generic versions that are in the market also. Some pills are even sold for 70 cents, which is not expensive at all. Timethoprim is an antibiotic with many uses, with all of this that I'm saying, it is a very important one. It's considered a very important one.
In conclusion, we thought trimethoprim is a really, really good antibiotic. It does have a long list of side effects, but those are not enough for it to be not prescribed. The benefits definitely outweigh the side effects in this one. It's also, like she just said, it's very accessible. It's a cheap antibiotic. It can be found pretty much anywhere in the world, so there's high accessibility. It also remains effective. That's the most important part. After so many years of use, it is still effective today, 40 years after it was discovered. We still believe that scientists should try to find new drugs because resistance is definitely increasing, and in the future it may not be as effective as it is today. So hopefully research in the future will be able to find new ways to treat these infections. But still, trimethoprim is definitely one of the better antibiotics that is used today. Thank you.
Thank you.